Welcome to our joint annual general meeting between Blackpool CCG and Fylde CCG, and thank you for joining us today. Whilst under normal circumstances, members of the public are able to attend our annual general meeting. However, government social isolation requirements constitute special reasons to avoid face-to-face gathering as permitted by legislation. Therefore, this meeting is being held virtually and broadcast live via Microsoft Teams. Members of the public were given the opportunity to ask questions in advance via the CCG's website, and answers will be provided later in the agenda. Should there be any further questions arising from the business discussed at the meeting, please contact us via our website. The annual reports and accounts for 2019-2020 for each CCG have been published on the joint CCG's website, and summary versions are also available. The CCGs are responsible for planning and buying health services across the Fylde coast. The annual report set out the progress made to develop safe, high quality health services for local people during 2019-2020. They also describe how the NHS has worked closely with local GPs, patients, carers, local authorities and partner organisations to help shape plans for the future. The agenda for this meeting will begin with Blackpool CCG presenting their formal business, followed by Fylde CCG presenting theirs. A presentation will then be given by Jane Scattergood, Director of Nursing and Quality, on the CCG's response to COVID-19. At this point, I would like to welcome Jane, who joined the CCGs in March. The presentation will be followed by answers to any questions received. I would now like to move into the statutory part of the meeting and welcome everybody to the annual general meeting of Blackpool CCG. As a clinical commissioning group, Blackpool CCG is a clinically led organisation which brings together 17 local GP practices and other health professionals to plan and design services to meet local patients' needs. Our GP practices serve a registered population of 174,000 patients of a largely coastal area. I would like to take this opportunity to thank the governing body, members and all the CCG staff, including our commissioning support unit embedded team, for their continued hard work and support over the past year. A number of apologies have been received from governing body members, and those will be recorded in the minutes. Okay, we have to now move to the minutes of the previous meeting held on the 16th of September 2019, and those were accepted as the correct record at a governing body meeting held in public in November 2019 and are now presented for approval. Could I ask two members of the governing body to propose and second this?
Andrew Harrison here. I'd like to propose that we accept those minutes as a correct record. Thank you.
Thank you. And Helen, I think if she's here, could you second those?
Helen Williams, lay member governing body. I second that these are an accurate record.
Okay, thanks both of you for that. Much appreciated. Okay, so we'll now move on to the annual report and accounts for 2019-20. And I'm going to invite John Gaskins, who's our Acting Chief Finance Officer, to present the annual report and accounts for both Blackpool and Fylde CCGs. Thank you, John.
I'm pleased to present the financial accounts for 2019-20 for the two Fylde CCGs. The slide that you can see there has the three statutory financial targets for both CCGs on there. I won't go through the detail that is within them. They are the same that we've had in previous years of the revenue control total, a cash limit, and our better payment practice code. The statutory duties were met for both CCGs, as shown on the current slide for the revenue control total, and next slide, please, Mark, for the cash and the better payment practice code. I'm also pleased to report that both CCGs received clean audit reports for their 2019-20 accounts.
Thank you, John. I think we can move on to that concludes actually the statutory part of Blackpool CCG's annual general meeting. And I'll now hand you over to Dr. Adam Janjua, Chair of Fylde CCG. Adam, thank you.
Thank you, Roy. For this part, I'd just like to welcome everyone to the annual general meeting of the Fylde and Wire CCG. As a clinical commissioning group, the Fylde and Wire CCG is responsible for buying healthcare on behalf of its local population for an approximate population of 178,000 people. We work very closely on a daily basis with our 19 GP practices, each of whom make up the CCG's membership. So on behalf of the governing body and the councillor members, I would first like to express my thanks to all the staff in the CCG for the tremendous enthusiasm and diligence, especially over the past couple of months. I'd also like to thank our NHS and local authority partners with whom we have forged really strong working relationships, and also for our local volunteers and voluntary groups for their fantastic contribution over the past 12 months. So if we move to the apologies for absence, we've received a number of apologies for absence from the governing body members, and these will be recorded in the minutes. Now I'm going to refer to the minutes of the previous meeting that we held on the 16th of September 2019. These were accepted as a correct record at the governing body meeting that we held in public in November 2019 and are now presented for approval. Could I just ask two members of the governing body to propose and to second this, please?
Hi, Adam. Andrew Harrison again here. I propose that we accept these minutes as a true record of the event last year. Thank you.
Great, thank you, Andrew. Anyone seconding it? I think Jackie.
Yes, I'm Jackie Panisar, elected GP clinical lead, and I'd be happy to second these as an accurate record.
Okay, thank you both. So the annual report and accounts, I thank John for taking us through the annual report and accounts for both CCGs early in the meeting. We are now moving to the COVID-19 and the Fylde Coast response, for which I'd like to invite our Director of Nursing, Jane Scattergood, who will give a presentation on the Fylde Coast response to COVID-19. Thank you.
Thank you, Dr. Janjua. Good evening, everybody. The job of the CCG in the event of an emergency incident being declared is to work across the system with our health partners and broader partners across local authority and the charitable sector to make sure that the response to whatever that emergency may be is effectively coordinated and discharged, and that the CCG makes its contribution. This is a health emergency like no other. Incidents often occur, some floods or a big road traffic collision, and then are resolved within 24-48 hours. You'll understand and appreciate that we're now a good 6 months into this incident and it's not over yet. The incident has been managed in terms of NHS under a national incident command structure. There are 4 levels of incident command in the NHS, and we've been at the peak level for the majority of the last 6 months at national command, stepping down to regional command more recently in the summer, although we may well step up to national command again in the near future. In response to that, the CCG set up its incident command centre at the beginning of March 2020, and you can see some of the numbers there about the numbers of pieces of information that the CCG Incident Command Centres processed or logged, the number of calls we've had in support of GP practices, the Fylde Coast system calls, practice managers and GP teleconferences to cascade and share information and hear about problems and respond effectively to them. We are not a storage and distribution centre, but nevertheless, in the early days of the response, we did manage to source and provide personal protective equipment to all 36 Fylde Coast GP practices to make sure that they had a cushion supply. And if patients did need to be seen face to face in the early stages of the pandemic, no practice was left unsupported. We also reached out and supported the very vulnerable, those people who live in nursing and residential care. We provided all care homes with vital signs monitoring equipment to help them understand the symptoms that their residents were experiencing and communicate with medical support with doctors about what to do about those results. And we coordinated the tests for COVID-19 for pre-admission to nursing homes and for social care staff and their family members to try and support that workforce. We undertook a test and adjust survey with our partners and the members and with our staff and with GP practices to just test what our response was like and how well we were coping as a CCG and how well we were meeting people's needs. And I'll share the next few slides with you with some more infographics about the responses that came back. So we identified with the general practices a number of risks around patients experiencing reduced access to services or indeed avoiding services for fear of being in and around the hospital. We acknowledge the risk to mental health due to social isolation, and we acknowledge the risk of longer waiting lists and longer waiting times and harms that can happen to people whilst they're waiting for elective surgeries. But we did develop new ways of working without face-to-face contact, with virtual consultation and using digital solutions much more rapidly. In terms of managing the emergency, we went out to our system partners and asked them for their opinions on how well they felt the incident command had interfaced with them, how useful they felt the CCG support had been, how well the CCG had brokered arrangements or shared information or helped the system understand how best to get the most bang for its buck in terms of emergency response. And I think this slide will demonstrate that the responses were very, very supportive, very, very positive, and we're gratified to hear it. We have taken some lessons to learn and to make further improvements, but certainly results of 100% finding practice managers teleconference useful is really good feedback and shows we were working in the right space. We did go out to the patient and public. This survey was open for just over a week and we got an amazing 776 returns. We were reassured to hear that 85% of the responders felt they were coping well with the pandemic, but understand that 15% then were not coping well, and we needed to step up our responses in terms of managing access to support mechanisms and making sure that we shared as much of the support menu that's available from charities, local authority, from health services as possible, so that people felt supported through this very difficult and enduring time. Otherwise, I think those numbers speak for themselves. 80% were satisfied with the service they received, but a worrying 29% said they wouldn't seek healthcare support because they were concerned about catching COVID-19. And our clinicians and our comms teams and partners and chair of Fylde and Ware CCG took to digital media to reassure and encourage people to access health services if they needed to. We did do an awful lot of work to support care homes and domiciliary providers, as I've mentioned earlier. We made sure that they were offered training, and the vast majority took up that training in and around PPE use in infection prevention and control. And the homes that didn't were parts of big organisations that had sufficient in-house training. We made sure that nurses and leaders in the care homes were able to easily manage to use specialist equipment for end-of-life care, like a syringe driver, and that people had support to understand how to manage isolation and cohorting when somebody returns to a home that was COVID-19 positive. The CCGs necessarily, and as it is every winter, been involved in winter planning and restoration, an active member working collaboratively at place with our primary partner in Blackpool Teaching Hospitals to make sure that as much restoration as possible this winter happens, and happens at pace and happens effectively and safely, and that we stand ready to support anybody who needs unplanned or planned care over the remainder of this year. Some things that didn't pause, the whole system has continued to meet at a system improvement board, still driving quality improvement and offering robust assurance to the populations we serve and to NHS England and to the Department of Health and Social Care. Some patient-facing committees continue to meet. The committees that look and scrutinise at things that matter, that are about safety and patient experience and effective and safe treatment. So the Quality Improvement and Engagement Committee, Clinical Commissioning Committee, Primary Care Commissioning Committee, all have been working hard throughout the pandemic and continue to do so. I think I said at the beginning that we are working to an NHS command structure, and for all of this financial year we are operating as part of a response to command cells. The out of hospital cell for Lancashire and South Cumbria is led by Dr. Amanda Doyle, and senior members of the CCG, including David Bonson and Andrew Harrison, have been involved in delivering some of the work directed by that cell, and the cell has pulled in a significant amount of clinical opinion from GP and nursing colleagues across the patch. Some of us are working in partnership with the Local Resilience Forum, which is a multi-agency response to any emergency, so working alongside local authority and the police and other wider partners than health. And our Deputy Director of Nursing and Quality, Nick Medway, has been leading the incident response for the CCGs. Thank you. Thank you, Chair.
Okay, thank you very much, Jane, and thank you for that very comprehensive view there of the CCG's response to the COVID-19 pandemic. It's part of the agenda where we move to questions and answers, and I'll read out the questions that we received prior to the meeting and invite our colleagues who are here tonight to answer to those questions. So we have received one question from Mr. Frank Martin, who's a Wyre resident. I'll now read out that question. Will enough appropriate resources be available to the Lancashire Resilience Forum in order that care home residents and staff are better protected from COVID-19 than they were earlier this year, now that winter approaches and the virus infection rate is rising? Could I ask Jane Scattergood to respond to this question, please? Thank you, Jane.
Thank you, Rob. The Local Resilience Forum, or LRF, for Lancashire is made up of statutory and public service organisations that come together in the event of an emergency, and they pool expertise to provide a response to support the population. The LRF is mobilised in the event of an emergency, but it doesn't have resources to commit beyond the resources that its constituents or organisations already direct. Support to and quality monitoring of regulated care, so the care home sector, is the responsibility of local authority, which for Fylde and Wyre is Lancashire County Council. The LRF has established a regulated care cell, drawing in expertise and decision makers from across health and social care to proactively offer support to regulated care throughout the emergency response. Fylde CCGs have, in addition to the LRF functions, offered and provided training to all care homes and domiciliary care providers. 100% of care homes have been offered training and 89% have taken up that offer. Those that declined are largely well served by existing organisational training. Fylde CCGs have been able to support care homes with mutual aid for PPE, provision of vital signs equipment, administer staff swabbing and antibody testing, and a commitment to offer practical support when care homes experience a staffing crisis. This emergency provision builds upon the existing care home teams provision that extends across the Fylde coast. Thank you, Chair.
Okay, thank you, Jane. So, as I mentioned at the beginning of the meeting, should there be any questions resulting from the presentations or the business that we've gone through this evening, could members of the public please contact us via our websites in the usual way. Thank you very much. And could I just, I'm sure Adam would join with me in this, could I just thank all the staff of the CCG once again for their resilience and fortitude during this pandemic. It's been a particularly difficult time, as we all know, but I think everybody has pulled together in such a great and fantastic way. So we appreciate it. We appreciate all our staff, and we appreciate everyone who's doing everything they can within the community for all of the patients and people on the Fylde coast. So now I'll hand over to Dr. Adam Janjua. Thank you, Adam.
Thank you, Roy. It's fallen on me to do the closing remarks for which I'd like to thank all of you very much for joining us today, particularly under these unusual circumstances. But before we conclude, just on behalf of Roy and myself, I would like to thank Pam, Louise, Mark, and our wonderful comms team for helping us to organize and set up this event. Obviously, we can't meet in person just yet, but hope that next year we will be able to resume our joint AGM meeting arrangements with Blackpool Teaching Hospitals. And we also look forward to meeting you all in person once again, once the COVID-19 pandemic is over. All that remains for me to say is please do keep safe and well. And I now declare this meeting closed. Thank you very much.